It's a very interesting evolution of aesthetic industry. AI is becoming integral part of the modern aesthetics. In this process, a lot of data is actually generated. Currently, I'm using a software called Clinishow, one of the best in the industry. So quite a useful software for us. And the best part is everything is at one place. Completely loving it.
So, Dr. Pankaj, tell me, how do you see the entire aesthetic health evolving in the next decade?
Now we are moving towards treatments which give you more natural results. Patients don't want drastic changes, they want subtle changes. And most of the patients, they want a roadmap for their treatments. For example, earlier we used to see patients who were then in the 40s or 50s. Now we are seeing patients who are as young as like not even 20, and they're very careful about their skin health, their skin journey. And we are designing treatments in a stepwise manner that, okay, somebody who's in their 20s, what kind of treatment should be done? 30s, what kind of treatment should be done? So at the same point of time, it also becomes very important to capture the data, to maintain the records that what journey we started, what all treatments we did a few years back, what treatments we are supposed to do now. It's a very interesting evolution of aesthetic industry. More and more patients, more and more people are keen to take these treatments.
So, is it safe to say that you're looking at a lot of data these days to understand the trends?
A lot of data, and it becomes very important also because in our industry, when the patient is there, he's going to stick around for a couple of years. In this process, a lot of data is actually generated, and it becomes very important to organize that data, to keep it so that you are able to deliver that perfect set of treatments which you have designed for that patient. If you don't have data, you'll do random treatment because you're not aware what you did last year, what you did last year, what exactly you planned for that patient when you saw that patient 3 years back for a consult, right?
Right,
So
right.
if you have that arrangement where you have all the records, all the data, then you'll be able to customize their treatments. You'll be able to make a protocol. You'll be able to generate a blueprint that, okay, this is how we're going to proceed over the period of time.
So, what systems are you using right now?
I currently I'm using a software called Clinishow, which is I think one of the best in the industry. I moved to Clinishow after using a lot of softwares. I used most of the expensive ones available, most
Right.
of those OG softwares which everybody quotes, but they were not fulfilling my needs because there were two aspects. So one, the software has a lot of features, but the question is how many features you are able to use, how many features are actually easy for you and your team to learn and use, right?
Right.
So I came across Clinishow, and my job has become much more easier. I'm able to keep all the data and the parameters at one place, be it the demography of the patient, be it the prescriptions. In fact, my pharmacy is there now on the Clinishow. Payment records are there, sessions and the reminders and everything is there. In fact, we have a lot of literature. So when we recommend something to our patients, we send the literature, reading material, post-treatment documents, pre-treatment documents through this. So quite a useful software for us.
So let's address the hottest topic of the day, AI. And we know medical aesthetics does not just mean treatment. There's so many devices and so many new innovations that are coming up every day. And I'm sure you're using tech in some way or the other. Where do you see this going right now?
AI is becoming integral part of the modern aesthetics, be it the devices. So a lot of devices we are using these days, they have inbuilt AI system. You just feed the demography, age and skin type, and the device tells you the parameters. And these parameters are not same for everyone. Like you change the age, skin type, the parameters are changed, right? So that's one of the basic thing. But in our practice, we are in the process of integrating AI in a big manner, right from the prescriptions, treatment recommendations. In fact, we are working on a protocol where the patients will get suggestions based on their past treatments which will be mediated through AI. Now, somebody who has got X treatment for one condition, and if there is another treatment which is known to work on the same, automatically that treatment will be recommended by our system to the patient. In fact, it will be prompted to the doctor also that, while writing the prescription, that you can suggest this also.
That sounds brilliant, yeah.
Now it's very important because there are so many procedures, there's so many treatments available that many times even doctors forget that, oh, we also have this to offer, right?
Right.
So these kind of AI-enabled tools will be beneficial for the patients and doctors both.
So how do you see patients respond to this? Do they feel overwhelmed, or they have a very positive approach to this kind of recommendation?
They're very happy, and they're curious to know that, doctor, I got a message from your clinic that, this is something you must try. So I want to know about this treatment, and why this treatment was not told by the manager, why I directly got the message. Then we tell that this message was triggered through AI based platform. So that's why nobody spoke about it, but we'll give you more information.
So we are seeing so many new things in terms of medical devices and also injectables and the rest of the facial treatments. What do you think is happening in the technology part of the data that you're seeing, the patient data, or in terms of the treatments that you're doing? How do you think it's going to change? And what are the top things that you've seen right now? I'm really keen to know what are the trends that you are betting on.
So now we are incorporating AI in our ecosystem. Now, when you have a lot of data and when you have softwares to read and assess that data through AI, you can actually design wonderful tools. So we are working on concepts where the patient will be sent educational materials regarding the treatments which patient will get benefited from. Suppose you're taking X treatment, right? But there are a few more treatments which are known to work on the same condition which you have, and if both of them are taken together, the results will be better. So we have a system where now, on time to time, you'll be sent data and educational material from our AI enabled tools so that you can understand that what additional treatments can be beneficial for you. So in that case, you'll be having a lot of information before you'll come to me and ask for an appointment, and you'll ask about that treatment. That is one. Even for the treatment recommendations, for the product recommendations. So suppose you're not able to visit clinic physically and you want to make your skincare. So based out of your past prescriptions,
Right.
we are enabling a tool where you'll be able to get a skincare customized, which will be designed for your skin type. And that will not be random, that will be based on your previous prescriptions which doctor has prescribed you, because now our system knows what kind of skin you have.
So I think this is going to lean more towards the patient experience.
Patient experience, and many times what happens, patients are not able to visualize the change. Now we are already using this. So I was talking about the tools which are in the process, in the pipeline.
Right.
We are already using this tool where in our hair transplant vertical. So when the patient is here, after the consult, we actually showcase the picture
This is what it's
that this is how you're going to look after the hair transplant in next 6 to 8 months. Youngsters are super happy because when they get our emailers regarding their treatments which we are recommending them, they study about them, and when they do their research, they're quite surprised that, doctor, this is exactly what I wanted, and I read about it and I found it that this is one of the best treatments for me.
Right. So, Doc, you've been using Clinicio for quite some time now, and I would love to hear your thoughts about it and how it has supported your clinic.
Wonderful experience, I'll say. Beautiful software, very easy to use, yet it is quite functional, evolving. And the best part is everything is at one place. So be it your prescriptions, your patient's packages, your billing, and your pharmacy medicines, your inventory, everything is at one place. So quite easy to use, functional, user interface is very nice, very aesthetically designed. Completely loving it.
Thank you, Doctor. Thank you for having us here, and it was wonderful talking to you. Thank you so much.
Pleasure.